What is the history of patient advocacy in healthcare? Imagine a time when patients were mostly passive recipients of care, with little say in their treatment. Over the past 50 years, patient advocacy has grown into a vital part of healthcare, helping people become active participants in their own health. Its roots go back to social movements in the 1960s and 1970s that fought for civil rights and equality, which inspired a new focus on patients' rights. In 1974, healthcare pioneers like George J. Annas and Joseph Healy introduced the idea of a patient rights advocate, emphasizing that patients should be informed and involved in decisions about their care. During this time, the self-help and self-care movements gained momentum, encouraging patients to take control of their health and challenge the traditional doctor-centered approach. Hospitals started formalizing patient advocacy roles in the late 1960s. For example, Mount Sinai Hospital in New York created the first patient representative department in 1967. Soon after, the American Hospital Association included a patient Bill of Rights in hospital accreditation standards around 1972, making patient advocacy an institutional priority. These steps helped ensure that patients' voices were heard and their needs addressed more systematically. The 1980s marked a turning point when advocacy expanded beyond hospitals into areas like medical research and public health. The HIV/AIDS crisis in the 1980s sparked grassroots activism, leading to stronger policies and programs to support affected patients. The Food and Drug Administration's Patient Representative Program grew to cover hundreds of diseases and conditions, giving patients a voice in regulatory decisions. Cancer patient advocacy also flourished, with the emergence of cancer navigators who help patients understand and manage their treatment options. In the 1990s and early 2000s, patient advocacy became more professional. Organizations formed to support patients, developing ethical standards and certification programs for advocates. Hospitals established patient advocate offices focused on safety, satisfaction, and communication. Research consistently shows that effective advocacy improves health outcomes, reduces costs, and strengthens the relationship between patients and healthcare providers. When it comes to pancreas health and pancreatic cancer, advocacy is especially important. Patients often face late diagnoses, aggressive disease, and tough treatment choices. Advocacy groups and support organizations help patients navigate complex healthcare systems, find specialized care, and understand their treatment options. Support groups offer emotional comfort and practical resources, helping patients feel less alone and more empowered. These efforts improve quality of life and ensure patients are active partners in their care. Overall, the story of patient advocacy is one of progress from passive acceptance to active engagement. Formal roles, organizations, and policies now support patients in making informed decisions and advocating for their needs. This evolution has made healthcare more patient-centered, especially in challenging areas like pancreatic cancer, where advocacy helps address both medical and emotional challenges. Remember, always consult healthcare professionals for personalized advice, but know that advocacy has come a long way in making sure patients are heard, supported, and empowered every step of the way.